Have you ever wondered what actually happens inside your body if you keep the same habits at 60 that you had at 30? What if something that felt completely safe for decades could quietly change the health of one of your most important glands, the prostate, once you hit your senior years? Today, we're going deep into a question that men rarely talk about, but every man over 60 should know. What really happens to your prostate if you masturbate every day after 60? The answer may surprise you because it's not all good news. Let's start with a simple truth. The prostate is a small gland, but it plays a massive role in a man's health, especially as you age. Located just below the bladder, the prostate produces seminal fluid, which nourishes and transports sperm. For most of your life, you probably never gave it much thought until problems start showing up. After 50 or 60, this little gland becomes one of the biggest concerns for men worldwide. Because this is when conditions like benign prostatic hyperplasia (BPH), prostatitis, and even prostate cancer become far more common. So, what happens when you masturbate daily at this age? Is it healthy? Is it dangerous? Or is it a mix of both? Let's break it down based on science, not myths. First, the good news. Ejaculation itself is not inherently harmful. In fact, some studies suggest that regular ejaculation, whether through sex or masturbation, might actually help flush out old prostate fluid, which could reduce the risk of infections or inflammation. Think of it like cleaning the pipes. When you release, you remove stagnant fluid that could otherwise harbor bacteria. There's even research linking frequent ejaculation in middle age to a slightly lower risk of prostate cancer later on. That sounds great, right? So, should you keep doing it every day? Not so fast. Here's where things get tricky. Daily masturbation at 60 is not the same as daily masturbation at 30. Why? Because the aging body works differently. Testosterone levels drop, blood flow slows, and the prostate itself is more sensitive to irritation. When you stimulate your prostate area too often, especially if the sessions are vigorous or prolonged, you can actually cause micro-inflammation inside the gland. Over time, this can contribute to chronic prostatitis, which shows up as pelvic pain, urinary problems, and even painful ejaculation. Many older men ignore this discomfort, thinking it's normal aging, but sometimes it's linked to habits they never questioned. Another important factor is BPH, or benign prostatic hyperplasia. This is the non-cancerous enlargement of the prostate, and it affects the majority of men over 60. If you already have an enlarged prostate, frequent ejaculation can sometimes make urinary symptoms worse, at least temporarily. Why? Because the prostate swells slightly during sexual arousal and after orgasm, which can put extra pressure on the urethra, making it harder to urinate. If you notice increased urgency, weak flow, or nighttime urination after frequent sessions, your prostate might be telling you to slow down. Now let's talk about blood flow and the pelvic floor. Ejaculation requires a series of strong muscle contractions, and in younger men, that's no problem. But after 60, those muscles aren't as resilient, and the nerves are more sensitive. Daily strain can lead to fatigue in the pelvic region, which can cause a dull ache or discomfort that lingers. Some men even develop what's called chronic pelvic pain syndrome. And here's the kicker. Many don't connect the dots between their habits and the symptoms. There's also the hormonal side. Each orgasm releases prolactin, a hormone that promotes relaxation, but in high frequency, it can lead to lower dopamine and even influence testosterone levels over time. If you're already experiencing age-related testosterone decline, too much sexual activity, even solo, could contribute to fatigue, mood swings, and reduced motivation. Balance is key, but the risks don't stop there. What about the prostate's long-term health? There is ongoing debate among scientists, but some urologists caution that excessive stimulation can contribute to chronic irritation, which is never ideal for a gland that is already at higher risk for disease. While masturbation alone doesn't cause cancer, chronic inflammation can create an environment that makes the prostate more vulnerable to problems. And remember, if you have underlying conditions like diabetes, hypertension, or heart disease, your circulation is already compromised, which can affect how your prostate and surrounding tissues respond to constant activity. So, should you quit completely? Not at all. Masturbation, when done in moderation, can still be part of a healthy lifestyle even after 60. It can relieve stress, improve sleep, and support mental well-being. The key word here is moderation. For some men, that means a few times a week rather than every day. For others, it might mean adjusting technique to reduce pressure and irritation. Avoid aggressive or prolonged sessions. And if you notice pain, burning, or changes in your urinary habits, that's your signal to check with a doctor. Here are a few practical tips if you choose to keep masturbation as part of your life after 60. First, stay hydrated. Good hydration supports healthy prostate fluid and reduces irritation. Second, keep sessions gentle and short. Avoid squeezing or bending the penis in unnatural ways. This prevents trauma to delicate tissues. Third, pay attention to lubrication. Dry friction can irritate not just the skin but also internal structures that connect to the prostate. Fourth, give your body time to recover. If you feel sore or tired afterward, skip a day or two. And fifth, support your prostate health overall. That means eating anti-inflammatory foods like tomatoes, berries, and green vegetables, maintaining a healthy weight, and doing pelvic floor exercises to improve circulation. Here's something many men overlook. Lifestyle habits often affect the prostate more than sexual habits. Lack of exercise, sitting for long hours, and a poor diet high in processed food can inflame your prostate far more than an occasional masturbation session. So, if you really want a healthy prostate after 60, focus on the big picture: movement, nutrition, and regular checkups. Speaking of checkups, don't skip them. After 50, and definitely after 60, you should have regular prostate screenings. This includes a PSA blood test and, when recommended, a physical exam. Early detection of problems like BPH or cancer can make all the difference, and being honest with your doctor about your sexual habits can help them give you the best advice for your situation. Now, let's address one more thing: the mental side. Many older men feel guilty or ashamed about masturbation, thinking it's not appropriate at their age. That's a myth. There is nothing inherently wrong with self-pleasure if it's done safely and mindfully. The danger comes from extremes, either denying yourself any intimacy, which can lead to frustration and stress, or overindulging, which can harm your health. Balance, awareness, and honesty with yourself are what keep you healthy and happy. So, what really happens to your prostate if you masturbate every day after 60? In short, occasional ejaculation can help keep the gland healthy, but daily sessions, especially if intense, may increase the risk of irritation, worsen urinary symptoms, and contribute to chronic discomfort. The answer isn't stop completely, but adapt to your age and your body's needs. Remember, pleasure should never come at the cost of your health. If this video helped you understand your body better, give it a like, and subscribe for more science-based advice on men's health after 60. Knowledge is power, and your health is worth every bit of it.